particularly in France and Britain in the mid-1800s, who studied Mesmer's techniques, took out the hokey-pokey parts of it, the purple robes and some of the, like I say, more sort of occult trappings, and studied what is this power of mental suggestion? What does it mean? And other European doctors, particularly a Scotsman named James Braid in the mid-1900s, and later a French pharmacist named Émile Creux, studied this hypnosis phenomenon and started developing more sophisticated applications for different kinds of medical and psychological treatments. In more modern times, the American psychologist Clark Hull trained doctors to use hypnosis with soldiers in World War II for pain control when morphine was not available. Now for John, the morphine was there, or the whatever drugs they were, but he chose, because of family history, to bypass that. But in these situations where there simply was not morphine on the battlefield, they took, Clark Hull would train doctors and nurses to work with hypnosis. And the success of that was so impressive that it led to the formation, the first formation of a professional society for clinical and experimental hypnosis. And that was in 1949, not long after the war. And that grew into an international organization made up of physicians, psychologists, nurses, dentists, and even social workers, dedicated to the, quote, highest level of scientific inquiry and the application of hypnosis in the clinical setting. And then a little later, in 1957, the American Society for Clinical Hypnosis was formed by one of the luminaries in medical hypnosis, Dr. Milton Erickson, who I'll talk a little bit about later. He was a brilliant therapist. And that led to the professional certification of clinical hypnotherapists. So the training was good and being monitored. Now, since that time, despite the stigma that still follows even the term hypnosis, and keeps it from a much wider application that it deserves, it is used more and more for medical purposes, largely because of this growing body of scientific and anecdotal evidence that has proved its efficacy. So now we are at a point in history where the American Medical Association, the British Medical Association, the American Psychiatric Association, the American Psychological Association, and the American Dental Association have all recognized hypnosis as a viable therapeutic tool with many practical applications. A recent review of the National Library of Medicine, also known as PubMed, which some of you are already familiar with because it's a great way to find medical research on the internet, uncovered over 10,000 articles concerning the effectiveness of medical hypnosis. The documented effective uses in medicine are far wide-ranging, and they include, among others, stress management, pain management, fibromyalgia symptoms, migraines, weight reduction, or weight gain if there's an opposite problem in the body, cessation of smoking, drinking, breaking other unhealthy habits, conquering fears and phobias, controlling anxiety, depression, anger, preparing for surgery, and dental procedures. More and more presence in, because there's a lot of dental chickens out there that freeze up in the dental chair, which is a problem for the patient and a problem for the dentist too. William Ray, a professor of psychology and Penn State hypnosis researcher, examined more than 6,000 articles on the benefits of hypnosis that have been published in medical and psychological journals since the 1950s. In addition to the applications that I mentioned, he found evidence in effectiveness in helping with relief of gastrointestinal disorders such as ulcers, irritable bowel syndrome, colitis, and Crohn's disease. Reducing or eliminating nausea and vomiting associated with chemotherapy. So a lot of that study happening now with cancer patients. In boosting the immune response in the body. Both hypnosis has been studied that, and lighter forms of hypnosis, guided imagery, increasing documentation of how these practices can help boost the immune system in the body. Asthma, allergies, many skin disorders are often responsive to hypnotic suggestion. I had one client who came with Raynaud's syndrome, where your hands just get ice cold. And he was an engineer working with cold materials, so it was about to end his career, and he had tried the medical solutions and didn't work. And with hypnosis and breathing exercises, he was able to change that heat level in his hand and get back to work. So these, like I say, these learning that we can have much more influence and power over what we previously thought were involuntary responses of the body can really change our approach to health and healing. Another important medical application of hypnosis is helping patients develop and maintain the confidence and discipline to stick with the medical regimen long enough to see whether it works or not. That can be a huge problem, and therefore we can't really test even pharmacological treatments sometimes, because that discipline or the fears that arise can interfere with that. So it can be very powerful for boosting the confidence, boosting the commitment, the motivation. Now, I want to make it clear that when I use the term medical hypnosis, I am not suggesting by any means that a hypnotherapist is practicing medicine. Hypnosis is a complementary therapy and an adjunct to one's actual medical treatment. So when helping people with health issues, other than in some cases weight loss and smoking cessation, I always get referrals from their physicians. You want to be working in alliance. You want to be solving these things together. So if hypnosis isn't what the media has said it was, what is it? And as I said, that's not a real easy thing to say, because states of mind is a deep subject that we are now, with neuroscience, we're learning things in just a few years that took us hundreds of years to learn. But we still have a long way to go to see exactly what happens in the brain, exactly what responses there are to these mental states. But having said that, the word hypnosis comes from the Latin word hypnon, which means to put to sleep. Not asleep as we ordinarily think of sleep, but more, as he mentioned there, sometimes it's described as a guided daydream. There are many definitions that are used for it, but the one I prefer comes from the hypnotherapist I mentioned, Dr. Milton Erickson, was an MD. And this is what he said: the hypnotic trance may be defined for purposes of conceptualization as a state of increased awareness and responsiveness to ideas. By turning down the switch on one's incessant, distracting, or disturbing thought activity, and catalyzing a profound state of relaxed receptivity, the full power of the mind can be activated to achieve maximum results. Now, when I ask clients if they've ever been hypnotized before and they adamantly say no, I gently and as diplomatically as possible convince them that they have. Anytime that we get so absorbed in a good book or a good movie that we're watching a movie and we suddenly forget it's these actors, we are immersed in the story, or we're immersed in the book, or we're driving and suddenly, wow, we've gone 50 miles and didn't even notice that time passing. When the state of absorption is such that the focus is narrowed to a particular area, that is a trance state. So again, when we think of trance as being something strange. Trance is just a state of absorption. So when athletes feel it, artists, when they are in their creative, artists and crafts,